In 2013, a pregnant doctor came into the hospital to have a C-section operation. Typical with surgery, the anesthesiologist gave sedative medicine, but instead of drifting to sleep, she felt a sharp suffocation. She couldn't breathe, talk, move, or see, but she could hear, and her mind was awake. She received 10 milligrams of a neuromuscular blocker instead of 1 milligram of a sedative, an all too common syringe swap error where the wrong drug is given to the patient. The practice of anesthesia is a delicate balance. Every day, providers give precise combinations of patient-specific medication to allow up to 100 million life-saving procedures each year. Unfortunately, these stories are far more common than reported, and as a result of medication errors like these, patients can suffer from cardiac arrest, shock, bleeding, and the loss of life. A conservative estimate of the frequency of errors is 1 in every 207 anesthetics, adding up to $3.1 to $4.6 billion in costs. Syringe swaps in particular may account for 24 to 44% of all errors, affecting more than 24,000 annually in the US alone. Anesthesiologists routinely handle, mix, and inject medications themselves, while simultaneously watching monitors, performing hands-on procedures, and filling out medical records. Their job is critical to the safety of the patient, but unnecessarily difficult and without systems that help them do their job effectively. Mistakes happen in medicine, but they can be caught and prevented. Human error is highly scrutinized in medical practice, but while the amount of literature describing the problem has grown exponentially, rates of error remain flat. Available commercial solutions are costly and introduce time-consuming steps into the clinical workflow. As a result, adoption by providers has been mild, and no clinical data demonstrating efficacy has been published. Anesthesia providers need a quick and organized way to reliably identify medications prior to delivery in order to reduce the risk of syringe swap medication errors. Our team at OR Smart is developing systems-based approaches that help address problems that humans can't, ensuring that every OR has the tools to allow their providers to handle complexities and keep their patients safe. OR Smart, smarter medication delivery.